Hey guys, Dr. Mohammed, Cardiology Fellow. I've had a few people like this ask me about OMI. OMI and NOMI are terminologies that were recently proposed as a way to reclassify acute coronary syndromes, and I personally love it. I think that we should definitely further reclassify myocardial infarction to not only be more inclusive, but also to potentially benefit more patients. Now, there's been a lot of confusion regarding this, and based on people's responses online, attempting to ridicule even cardiologists for that matter, which really doesn't make sense to me, I think that we should definitely talk about this one. A lot of people are mistakenly believing that OMI and NOMI are going to replace STEMI and NSTEMI. That is simply not the case. STEMI and NSTEMI will continue to exist. OMI or OMI stands for occlusion myocardial infarction, and NOMI stands for non-occlusive MI. What OMI is referring to is total or near total occlusion of a coronary vessel that is an umbrella terminology that includes not only STEMIs, but also STEMI equivalents, such as Scarbosas, Wallens, De Winter, posterior wall, hyperacute T waves, new AV or vesicular blocks, AVR infarcts. It also includes NSTEMI type 1 and unstable angina, where there's no reliable EKG patterns, unfortunately, to guide us as of yet. NOMI, on the other hand, is just non-occlusive MI and refers to myocardial infarction that is due to anything and everything but an acute occlusion. So us in the cardiology field, we see cases of OMI all the time. We've all had patients that did not meet STEMI criteria, but after cathing them, we realized, hey, you know what, that was an acute occlusive infarct. So as cardiologists, we try our best to recognize the compilation of patterns. These patterns include EKG patterns, troponin levels, symptoms, patient history to help guide us to decide whether or not we should emergently activate the cath lab for an acute angiogram and possible intervention. But in the same way that every patient is unique, not all interventional cardiologists follow the same guidelines when it comes to this. And that's because there's simply a lack of guidance, unfortunately, beyond just STEMIs being acute emergencies. Retrospective data in some trials have shown that up to 30% of occlusive MIs did not meet STEMI criteria. That's concerning given the fact that patients with occlusive MIs can obviously benefit from urgent or early revascularization. So this terminology, OMI and NOMI, was created to hopefully address these limitations and include other possibilities of acute emergencies. STEMI has been an obvious one for a long time. But what are other things that we're missing that can be included within that 30%? Unfortunately, the data that we have on OMI and NOMI are all retrospective. We still have a lot of things to answer. For example, what is the timing and evolutionary EKG changes and patterns of all the other OMIs? We have excellent data on the STEMIs, but now we need more data on all the other OMIs besides just STEMI. Could we apply more sophisticated EKG technologies to help address some of this? How about coronary CTAs? Can we use that to our advantage? And most importantly, will urgent or emergent revascularization lead to better outcomes for OMIs the same way that it does for STEMIs? I know that intuitively you're like, of course it does. But remember, we don't have enough randomized controlled data to reinforce that. Remember, these cath procedures, especially when done in an emergent situation, comes with a lot of risk. And we definitely don't want to do high-risk procedures on patients based on assumption alone. We need really good data. And that's why it's taking time to incorporate this reclassification scheme into the guidelines. It's easy to say we want to do this, but we need to do this the right way for patient safety. I know that was long as hell, but that's the beauty of science. It continues to evolve, and I hope this helps with some of the confusion that you guys are having. So for more cardiology tips like this, go on my page and hit that follow button.